Welcome to A Doctor's View with Dr. Polivios, a podcast discussing everyday topics in health, fitness, and mental well-being, as well as providing an insight into medical life and its challenges. Please note that all opinions of the host and guests should not replace advice from your own doctor. Now sit back and enjoy the show.
This is live.
This is live now.
Me and Paul.
Haidar, lovely to see you.
Hi, Paul. Thank you so much. It's been a long time since we sat down here and here in Knightsbridge and had this interesting conversation. But I've certainly mellowed out over the last couple of years. Don't you think?
I think just from the preamble conversation we were having just before hitting the record button, you definitely seem calmer.
Yes, definitely. I think, all this thing about emotional regulation, I really looked into it a lot more. And it's been very useful over the last year with the COVID situation, because I think emotions have got out of hand. And it's perpetuated by general media, I think. It's a great drug to use, to sort of stir up the emotions.
There's definitely been a lot of different reactions to how things have evolved over the last, especially few months, I would say. I think even more so than when it all first started. When it all first started, everyone had a very clear, okay, we need to do this. And then as time went on and people became more fed up, and even within the healthcare industry, we're fed up. Clearly, we've got now new instances where we're being told to do one thing, and then the people telling us to do these things are doing something completely different, as I'm sure many have seen the headlines in the UK, and it's very frustrating.
Yeah, it's interesting. I think, before the at the start of the pandemic, we were listening to our associations and our regulatory bodies a lot more, I think. We were looking for more guidance. But I think now people are kind of working their way through this pandemic locally and sort of in a way that's relevant to themselves locally rather than nationally. So I think the leadership issue is not addressing our concerns and our anxieties. I think that's happening. That's just an impression that I've got over the last few months.
Yeah, actually, I wanted to ask, because you do a lot of life coaching and a lot of psychotherapy, and as part of your practice, and I wanted to ask what you're noticing in patients.
Yeah, definitely the anxieties are up for sure, and I think people are less resilient by what I'm seeing. People are uncertain in the uncertainties. They find uncertainty more of a dysregulator of emotions, than previously. And I think because we're exposed to these uncertainties on a daily basis, through the media and the social media. So it's sort of a constant dysregulation, of your stabilizing systems. So yeah, that's what I'm seeing actually. A lot more anxieties, and also a lot more anxieties in the younger age groups. So that's a bit of a challenge as well. Also, the younger populations are more likely to talk about these uncertainties and these distressing emotions. So that's coming through a lot more as well. But these are the times of constant change, I think. Whereas before, change took a long time for it to happen because there's less communication and sort of less intermingling of different ideas. Before, it took a long time for different ideas to sort of filter into your, thought process and mindset and exposure. Whereas now you're bombarded with new ideas on a constant basis.
One thing I've noticed that is the uncertainty that you're talking about is quite does play quite a dramatic effect actually on your mind, because just when you're thinking something is better, something new comes along the same picture, be it a new variant, be it a new rule, be it a new, and it's almost like there's no respite, and it's just been going on and on and on. It's like, when will it stop? And after a certain number of times, you're thinking, this is never going to end. And it does play havoc with your psyche.
Yeah. I mean, the intrusion is a lot greater, whereas before the intrusion was a lot less. You didn't have all these digital devices which sort of intrude into your physiology, so to speak, and into your body on a daily basis. So that wasn't present before. And, going forward with nanotechnology and, other big companies that are thinking about, implanting technology into your nervous system. So it just shows you how powerful that can be in dysregulating your stabilizing systems.
It's interesting you say that, because it's one of the main reasons why I haven't bought, say, a smartwatch yet. And because I just don't want another thing to have to charge, another thing to know more about me, or it's like it's so invasive wearing something that is attached to technology again. And maybe my attitude to that will change when I start exercising a bit more and I need to keep track of my fitness a bit better. But as it stands, it's like my phone's enough for the time being.
Yeah. I mean, there can be way too much information, and this is something that I see in the clinical practice where they're using greater technology to look at things and diagnose things. But if it's in the wrong hands, it creates a lot of anxiety and a lot of emotional distress. So it is really important to slow down, so to speak, with this sort of technological advance. But it is changing the way that humans are interacting, and something that I think will be quite scary in the future is sort of how children are going to develop with this constant uncertainty, and also this emotional dysregulation, particularly when it comes to wearing masks, because we grew up constantly looking at people's faces and sort of constantly understanding what these facial expressions are, and the links to their emotions and their behaviors, and you become quite good at reading other people's emotions, which is really important, from a biological standpoint and from a survival standpoint. But if you don't develop these skills early, it becomes very disadvantageous for yourself, as a human being in this world.
It's something I've never thought about, actually. The implication on say a baby or a 1-year-old, 2-year-old, because I wouldn't have thought that wearing a mask in public and all the rest, because the child is actually probably looking around and taking in other people's reactions.
It becomes a norm after a bit. It becomes a norm that the norm of the child is to be surrounded by people with masks. And that's quite a devastating evolutionary norm. Because you have millions of years of evolution development within the human being, reacting to people's faces and expressions, and now they've got these masks on. So it's going to be difficult to predict what's going to happen in the future. But certainly this this sort of increase in uncertainty and increase in emotional valence. It's going to be a bit of an issue, actually. I mean, we're fairly versed in human interactions, and we find it fairly difficult to sort of.
It is difficult and
deal with this uncertainty.
Yeah, it is difficult. Even in the hospital settings, it's difficult when you're chatting to patients, and obviously, I'm still advocating wearing them because it's part of it's part of keeping people safe and looking at data and all the rest. But it does make life difficult.
Well, there's a social pressure there, Paul. You see, we don't create behaviors in isolation. There's always a social pressure happening around us. So if the social pressure is wearing masks, you can't be outside the tribe, because otherwise it causes even greater emotional dysregulation. So there's greater stability in the social group and within the social hierarchy, and that's why we do what we do. But yeah, I mean, it's a difficult one. It's a difficult one about, how we can navigate out of this. And unfortunately, the political leadership is not being honest with this. They said that vaccines were the answer. And then they said, what was the other thing? Oh, it was vaccines, essentially. They said that vaccines were the answer out of this pandemic.
I will say I'm very much an advocate for it. And just anecdotally, at least even in places where I work, I've noticed that the number of people coming into the hospitals and requiring intensive care beds as compared to the numbers we had before are dramatically lower. And sure, people might be coming in with it. It's not to say that you won't catch COVID if you're vaccinated, but people are staying for a few days, going home, getting treatment. Sure, our treatment has improved as well as time's gone on. We've improved our management as we've learned more about things, but it does tend to be unvaccinated patients who are requiring ventilating, requiring intubating, and staying in intensive care. Especially when you're chatting to healthcare people and like myself, it's hard to listen to both sides of arguments because not because that people don't have a right to say them and a right to think the way that they think. It's completely understandable, and I completely get why someone would be anti this, anti that to some extent. I do understand, probably a lot. I understand more so now than I did when things first happened. But I also have to look at what I see in front of me on a daily basis. And I've seen the 30-year-olds die in front of me. I've seen the people that I've intubated at 3 a.m. I've seen the destruction that this has done to people. I've seen the way we've been overwhelmed. I've seen the extra ITU beds that we've had to just magically create out of thin air. And I've seen the challenges and the way it's impacted everyone. And so I want this to be over as much as anyone else. And you're kind of clinging to any little thing that could help that just to go away.
Yeah. I mean, as you alluded, keeping those channels of dialogue open between the opposites, I think that's such an important thing.
Yeah.
And, the moment that closes, you just get two polar existences, and that creates even greater conflicts and crises. It's
like I'm very much an advocate for freedom of speech, as I'm sure we've spoken about in the past, and I've got no issues with someone wanting to discuss with me whether or not vaccines are good or not, or if someone says, look, I don't want to wear a mask for these reasons, and we can have a chat about that, and we can both give our data, our evidence. The thing which frustrates me the most is the just if someone puts out something completely false on, say, social media. So someone says something like, this is the vaccine's a microchip tracking device, or 5G is responsible for this, and stuff that actually has, one, no evidence, and two, just if you took time to just even break it down and get out of this kind of mindset, you'd realize how idiotic it actually is. But people propagate this information, it spreads like wildfire, and I don't like having someone's lives in danger just purely by false information like that. I mean, that is clearly dangerous to me.
So this brings us on to this whole concept around deception and particularly self-deception, and probably maybe that humans are the only beings who can deceive. Which is really interesting. This whole concept around deception and why do people deceive, and
We see in the animal kingdom though.
Really?
Well. They do.
Do they deceive as well?
I think they do. I remember watching something. They pretend to play dead, and then they attack, or other members of their tribe come and attack the animal that was going to try and eat the animal that's playing dead. It does happen in the animal kingdom. I think humans are definitely probably the most adept at it for sure, but yeah, you do see it, and then we see it every day. Even patients in the loveliest possible will in the world, they always want to please you, and they deceive you in their lifestyle and what they do. And
it's a difficult one.
So
they say they're taking their medication, and you're sort of scratching your head, thinking, really.
Or they, the most common one is. When I ask them, do you smoke? And they say, oh no, I quit. And I asked them when they quit, and they said this morning. And this happens quite a lot, actually. They said, no, I'm never having another one again. It's like, up until this morning, you were smoking 40 a day. So you are still a smoker in terms of your anesthetic.
Well, we all do it.
Of course.
Of course. And, that's the biggest problem, I think, for all of us is when you start deceiving yourself and you start lying to yourself, and that's a big cause of emotional distress and emotional dysregulation.
Absolutely.
Rather than not telling the truth, because truth is such a it's difficult to grasp.
We do inherently we just want to please people, I think, a lot of the time. I mean, don't get me wrong, there's people that couldn't care less and what have you, and they just live their lives like that, and that's absolutely fine. And in actual fact, you could argue that's the best way of living your life, not caring. Debatable. There's you know what I mean, though.
That's one of the big 5 traits, and the big 5 traits are really the only statistically sound personality testing. Really, not Myers-Briggs and all, not sort of all these other things. And one of the big 5 is agreeableness.
Yeah,
that's a big personality trait. So there is a spectrum there. And I think the people you're talking about, doctors tend to be agreeable because doctors tend to love people rather than things. And you've got to be agreeable to love other people, so to speak.
Yeah.
And the people that essentially love things, they tend to be much less agreeable and, much more systematic and much more thingy person. The spectrum is there. And I've certainly seen it in my clinical practice. When I'm very agreeable, everything runs smoothly, so to speak. But I pay the price. I'm tired, I'm burnt out, and I'm not listening to myself because the patient comes first.
Not listening to your own advice, shall we say?
Yeah, and
Sorry, Haidar. I was just going to say, I remember reading your book on holiday, actually, and it had quite a lot of quite profound things, I must say. It was when we first met a few years ago, and it was an interesting read, and it's hard to imagine you not heeding your own advice. What's happened?
We deceive ourselves. That's what happens. We lie to ourselves. We know what's good for us, but we don't do it.
Yeah.
And as doctors, we intellectualize a lot of things. We'll always have an argument for not believing ourselves and not doing the things that we know what's good for us. There's always a reason for that.
I guess we do advise our patients to do lots of things, good diet, exercise, all the rest, and then we can sometimes do the complete opposite.
Yeah, I mean, this is more sort of psychological rather than physical. So, there's a lot of psychological things that we advise, but we don't do. So, compassion, for example, compassion is a great way of regulating your emotion within limits. Because being over compassionate burns you out. So if we're compassionate to our patients, the question is, are we compassionate to ourselves? And do we honestly ask these questions? And, what is our honest answer to this? And do we lie to ourselves about our relationship with self-compassion?
We touched on this, I think, in our roundtable discussion that we had in this very building quite a long time ago now. And we did conclude, even though we were speaking about a whole range of different things, we did say, I think we're very good at talking and looking after other people. Very, very good at it. But we always forget looking after ourselves. And took part in a webinar recently, and that was all about burnout in the healthcare industry and healthcare system. Nurses, doctors, all forms of healthcare professionals, and the things that resonate with so many people that were being said. It was unreal, actually. And I think the numbers now are just going through the roof. And I think no one has a clear idea of how to fix it. Ran a podcast that was published the other day, and we were talking about career breaks. Just if that should be part of the integrated as part of, say, the training program. Say, okay, you do 3 years of your core training, specialty training, and then you have a year career break or 6 months career break, and you don't get penalised for it. Because as it stands in the UK, at least in the NHS training programs, you're allowed a 6 month break, but that's for your entire thing. So if you need to, take extra time to resit exams or whatever it might be, you're eating into that time. It's not actually a prescribed career break. And we were just thinking about it, and I think people would be so much happier.
Yeah. I mean, definitely in terms of psychological therapy, having that space, psychological space is really important. And we do need to have lots of spaces in our careers, definitely. Yeah. Because people change their mind, people change their outlooks, people change their perspective.
Absolutely.
And we definitely need to give them that ability to stop and think and reflect. Proper reflection, not the exercise box ticking that we all go through every year, which is nonsensical, really. But yeah, I mean, I think GPs are quite good at this in the sense that they've picked this up, and then there's this whole thing around portfolio GPs, and I think going forward, I hope that we can see portfolio careers in all of the medical careers. And that's something for all the Royal Colleges to look into. The portfolio training, portfolio non-career grades, portfolio consultant grades.
So are you advocating the use of the portfolio in... I
think it helps.
Do you?
Yeah.
Interesting.
So, and it becomes part of your identity to a certain extent. So, you've got an interest in audio engineering, for example. Include audio engineering into your career as a physician.
I see.
So it becomes part and parcel of your career. I think that will create quite a nice tapestry or collage.
So not the portfolio that I'm thinking of that we currently have, say, for appraisals, revalidation and things like that, where or like foundation year doctors have to do, where they've got to reflect on this, link on this, and
no. Portfolio is okay. I do 3 clinics a week. I work in my startup. Another day I work as a volunteer here. I'm a comedian, here and so on. So and that's part and parcel of because I've had discussions with colleagues, and I say, well, I do psychotherapy. And said, no, don't mention that. That's got nothing to do with the medical practice.
I see.
Do you see what I mean? It's just what do you do in the hospital, in the clinic, related to your official medical work.
So your idea of portfolio actually is encompassing the things that you do that make you who you are, essentially, rather than just something that's completely devoted entirely to work. That sounds like a much better idea, actually. Much better.
And what that means is that everyone has a different pace and a different trajectory and a different final outcome. And that way, it sort of celebrates our differences and diversities and individuality. Just like we're being taught that general medicine and sort of what the GMC wants from us is patient-centered care. So we're going away from authoritarian care and sort of more towards patient-centered care. How about diversity of doctors' career well-being for the physician or the surgeon?
It would actually encourage you to not feel guilty about doing the things that you enjoy in life to some extent, because
and you can incorporate it into your into your inverted commas work life.
Sure.
And it creates that balance.
Sure.
Rather than separating the two and having to wear different masks for different situations.
It's an interesting thought, and one I don't think has been explored enough, actually, because we've all got interests, and sometimes they can help and be related to medicine, be it okay, interest in audio engineering and things like that doesn't immediately have some correlation with medicine unless I'm doing the medical podcast side of things. But the number of times I've helped people at work with certain things to do with work because of it, it's been quite a lot. So,
and if you're allowed to open up to these things and also be part of the whole appraisal process or the whole regulatory process or whatever you want to call it, it just takes that pressure off, I think.
Yeah.
And it just becomes more of a natural profession.
Yeah.
Just looking back to how physicians were before, essentially they did everything. There were poets and philosophers and thinkers and writers, and there wasn't that separation and that sort of dichotomy that you're a physician and that's it.
Yeah.
If you can bring all the other aspects that gives you that purpose and that passion and that meaning in life into the workspace, it just makes you more likely to survive the difficulties of life and take on the suffering of life per se and the suffering of your patients.
Yeah, because at least you have an outlet, and everyone's got their outlets.
Yeah.
Be it some people enjoy going for walks, other people enjoy fixing their cars, other people enjoy recording a podcast or whatever it might be, and I'll play a musical instrument or what have you. And it would be nice if that was acknowledged.
Yeah. That whole creative outlet. If that can be allowed.
Because here's the thing: if you were given the choice of doctors, for example, and patients don't know what you do in your free time and what have you, but if you were given two doctors in front of you and one of them is very, very career focused to the point where all they can do is just that part of their job, very little. They go home and they read in their free time. All they do is read nothing about, say you're an ophthalmologist, read nothing about the eye, and they become professor in ophthalmology. And you're presented with another doctor who, again, very good at their job, but in their free time, they read a bit, of course, to keep up their skills and what have you. But actually, they branch out and they've got musical instrument playing. They got musical ability. They got they can fix stuff and they do all these things. It feels like, at least to me, I'd much rather want to open up and have a conversation with the latter. Because they've got a bit more understanding maybe of social situations, of how the world works and how people may think normally,
Yeah, I mean, it's that whole thing around human connection, isn't it? And that's what causes the healing. Is that human intimacy and that human connection and that human touch. And I think it's more likely to happen that way rather than the traditional mechanistic way, and then give them human qualities. And giving them courses on communication skills and So we're kind of going a bit backwards.
Yeah.
Well, I guess it's a bit like the army. You sort of beat them up and then break them down and then build them back up again. Maybe. I mean, there's always a role for them as well. So if they can't communicate, they can always press a few buttons and cut some tissue out, and they'll be absolutely fine. And
of course,
we know many examples like that, amongst our colleagues, and good luck to them. But I think we should celebrate everyone, so to speak. These people and the other people, and but this, we do need this open dialogue, rather than closing things down and because it's so easy to do that, and maybe there's a bit more of that happening over the last year. But we are going through a pandemic, and we haven't been through one in a very long time.
For a very long time, yeah, absolutely. And there's hoping that it ends soon and we can go back to our normal way of life. But we were discussing what before coming here, we were sort of thinking about what to chat about, because as you normally what happens is we have no idea up until we actually meet, and things just kind of flow. And we did come up with you came up with the idea of talking about psychology of medicine, how that's changed in over the last few years. And it was interesting when you told me that. I thought back to our strikes that we had a few years ago about the junior doctor contract. And
we nearly striked, actually. I was a house officer in 1999. And I think we striked for a week. A week or 2 days or something like that. And it had a positive effect, I think.
Yeah.
It's sort of the medical authorities took note, and it worked.
Yeah.
But we were wearing our white coats, I remember.
I just, don't get me wrong. I appreciate things have changed, but it's something I've spoken about in the past where, sometimes...
Did you join them?
No, I wasn't outside. Do you know, oddly enough, every day that the strike was happening, bar one, I was actually rotated off, as it were, apart from one day where I did strike, yes, for one day.
How did that feel?
Not very comfortable, actually. In
terms of kind of internal guilt, and
there was a bit of internal guilt, and it wasn't as easy as I thought it would be, and it was fine. You knew it was maybe slightly different for me compared to people that were on ward, doing ward rounds daily. I was quite a very junior anaesthetist at the time, so I was always paired up with a consultant. So me not being there didn't really make the biggest of impacts, as it were, because my job could still be done. And it would be very different, say, to all the medical doctors and the surgical junior doctors who have to do all the ward round jobs and all the rest. So
what was the consequence of that? What was the blowback, so to speak, following the with your colleagues and the ones that didn't strike?
There was minimal impact in terms of patients, oddly enough, because there were people that were doing those jobs, but it was a big inconvenience. And so what it meant, and it wasn't something that could be sustainable. It was fine for the 2-3 days that the strikes happened, but it's definitely not a sustainable thing. And I think if it carried on for much longer, there would be more consequences. And the reason why I say there was minimal consequences because the consultants were able to step down in a way, so they were covering the bleeps, and they were covering take up the slack and doing the odd ward round jobs and what have you. And also there was a lot of people that weren't eligible to strike, so staff grades, trust grades, who weren't covered by that BMA indemnity, as it were. So they weren't part of that contract, so they were still working, and that makes up quite a considerable part of the NHS. So there was still a lot of doctors around, but obviously the trainees were the majority that I knew did take striking action. We were heavily penalised for it in terms of pay, because if you striked, you weren't paid for that day. And I remember the amount that they took off for that one day. For me was absolutely astronomical, and I said, I don't earn this much in a day, and then their rationale was, it's strike action, we're allowed to charge you by the hour. And so, and that was their way of saying, don't do this again, almost, in a way. So it was quite disgusting. I told them they were just thieves. But there you go. It's yeah. I mean, if I'd strike for 10 days in a row, I said I'd have to start owing you money at this point, because so they have their ways of doing things. And did it make a difference? I think it did, in terms of what the overall contract achieved later on. Is it perfect? No, not by any means. But here we are. At the end of the day, Haidar, we are, if you're working in the NHS, you are a public sector worker, and you are at the mercy of people that control that. So I think to think otherwise is slightly naive, to think that we have more power than we potentially would like to have in terms of governing these things. But ultimately, you are at the mercy of these people who do control it.
I mean, within any hierarchy, you are governed by that hierarchy, and the NHS is a very good example of a working hierarchy. And the advantages of a hierarchy is that you can still function, and it does regulate your emotions quite well. And the literature shows that the higher up you are in the hierarchy, the better your serotonin levels are. And
I can imagine. Absolutely, I can imagine.
So with every difficulty or strife or uncertainty that sort of hits you, you're more likely to overcome it the higher up you are in the hierarchy. So,
and don't get me wrong, I truly believe that the NHS requires a hierarchy to
there's
to
hierarchies
function.
everywhere.
Yeah.
I mean, every system within this world is made up of hierarchies, and as you know, hierarchies are sort of dissipated structures, in the sense there's a constant flux between different hierarchies that intermingle with each other. Just like the body, our bodies is not just sort of a static thing; it's a constant flux thing. Within our bodies, all our cells are sort of changing on a continuous basis. And at the same time, we're within the social structure. So my behavior is governed by your behavior, and your behavior is governed by my behavior. And then this is our microcosm of social interaction, which is within another microcosm of a bigger social interaction, so on. So it's sort of constantly, a constantly changing hierarchical structure that sort of happens within it. And the most successful hierarchies are based not on power, and because when we look at power, it's very destructive and it just breaks down. The best ones that work is actually competence. So competence is what makes hierarchies work. Yeah. And we see that in the NHS, and whenever a hierarchy is based on power, it just breaks down and it turns into a chaotic situation. And this can be a department in the hospital or within the hospital itself. If you've got an incompetent CEO within an NHS, it disintegrates into all kinds of abuse of power and
you do see that.
I mean, we've got examples of it here in the UK. We don't want to name them. Hierarchies actually regulate the your emotional systems, and having done that strike. Junior doctor strike, there was a bit of shaking of the hierarchy, so to speak, but then it sort of
there was
then the upper people realized that there needs to be a change. So that slight disruption of the hierarchy allowed for the people at the top to actually listen, and that's what it's about, really. Sort of people at the top do need to be very attentive and observe what's happening, and once people at the top are not observant and not make the changes, that structure will come tumbling down. Is that going to happen to the NHS? Well, I think we're still working at the moment.
Yes,
and,
we are.
And they're making changes. I think they're making changes. They're realizing that the old system's not working anymore. And how can we bring all these different small hierarchies into the main fold? That's the next challenge over the next few years.
Yeah, it's going to be an interesting development over, like you say, the next few years, because especially with COVID and everything, there has been a mild shake-up of the way things are running, and also it has made people rethink how the hospital needs to be structured. Yeah. So it will be interesting to see how this develops over time. And I'm very much an advocate for the NHS. It's a lovely, I think it's
the NHS is an ideal. So, we're all for the ideal. And, the ideal is a very abstract concept. But at the end of the day, we need high resolution physical answers to this, and that happens on the ground. So as a abstract ideal concept, that's it's like compassion. Compassion is an abstract concept, but in order to sort of conceptualize the ideal, you need to actually do the process of how can we translate compassion on a high resolution? Being kind to your son or your daughter or your brother or someone close to you, or your girlfriend or your boyfriend or whoever it is, rather than shooting down the whole compassion ideal. So I think the NHS is not going to go anywhere. But it needs to be relevant down on the ground. And I think that's where I think smaller units of people actually getting good results and innovation. I mean, if we can allow innovation to happen, much more regularly.
I think that's something that's changed a lot over time, and I've spoken about this before. That people took a lot more risks in the healthcare industry, even as doctors, they would come up with an idea and go, this is pioneering. It might work. Someone might die. Someone might but let's give it a go, and people are for that. Whereas now things are very much. There's a fear of trying something different. There's a fear of repercussion. Some of the things that were done in the past have led to the pioneering things that we can do now, be it organ transplant, be it cardiac bypass, be it the invention of our airways and laryngeal mask airways. All these things, the way that they would come up with, you would probably lose your job and go to jail now if you did those things in the ward setting the way that they did back then.
Yeah. But I think it's happening, in small pockets in different areas where the leadership allow them to have that.
I hope so.
Change, and also they are embracing that uncertainty and that failure.
I hope so.
Yeah, I think it is happening.
Because I think one of the dangers is that we do just go down a very protocol-driven healthcare service, which
with this pandemic, it didn't work.
I think you're correct. I think you're correct.
With what you've experienced in ITU, it's literally every single case is right. Let's learn from this case. Yeah.
There was you had an overall outline of the disease and how it affected the person, but you did find that everyone was quite different in their own little way. Some were very different, but on the whole, you had to tailor treatment for that individual person. It wasn't a one-stop shop. Everyone that comes in does this, and I think
the protocol will come after the pandemic. I mean, that's the protocol will be there, but that's coming after the uncertainty. We're still going through this process of uncertainty with the pandemic. So yeah, that's the next phase.
It's one of those times where it's sad that it took something like this to happen, but it is one of those times which did jumpstart that kind of ingenuity and, okay, let's try this and let's give this a go. And we're stuck. We need to come up with something, and people were trying different things to help these patients with the best will in the world, and some things worked, some things didn't, but as a result of which new things came about. And it is a shame that it took something like this to allow for that poetic license, shall we say, for want of a better word. But yeah. You okay?
Yeah, just reflecting. Yeah, you got to reflect about these things.
Take your time.
Yeah. So, what else are we talking about then?
I must say, Haidar, this interview's been very different to previous ones. Yeah, I must say, you definitely feel. I feel when we started, you did say you've calmed down quite a lot. You're very you're a bit more thoughtful, I think.
Yes.
Now than you have been.
I think it's a good idea. Yeah. Well, what can I say? I'm getting old, I think. And that's what it is.
You're still young at heart.
Yeah, I'm young at heart. But I think when you make a lot of mistakes, you realize, how much you don't know about a lot of things. So I guess I'm a bit more cautious about not running away with your thoughts, so to speak.
Sure.
So maybe that's what's happening. But I know, once you have a few scares in life, you kind of slow down and you start enjoying every moment and consider every difficulty, so to speak, another opportunity for learning. And I think that's what's happened over the years.
Yeah.
Instead of considering something, a disaster or a chaotic event, it's actually an opportunity for learning. And I'm just really realizing that I know less and less, which is quite a humbling thing. That's what I've realized over the years.
Yeah.
So I'd rather listen rather than speak. That's what I'm realizing. Which I've always been that way anyway. To be honest with you, I've always been a bit of a listener rather than a talker.
How's that affected your podcast?
Fine, because there's more time for the guests talk about themselves, which is what it's about.
Yeah.
So for me, it's absolutely fine, and I really enjoy it. Yeah. I mean, you were on the podcast last time, and I think you enjoyed yourself on the podcast.
Yeah, I did. Had a good time. Yeah. It was. It's always enjoyable chatting.
We did get a comment saying that it's not as fun as the last ones, because I remember, the one before we had a bit of a good time.
Yeah. I think the very
talking bollocks, of course.
We were talking. I think it was the first time we met here. First time I met you, I thought, what have I done? It was
reputation down.
It was insane.
Down the pan.
It was was so different to the other conversations that I've had with people, and it was kind of refreshing actually, and it did help pave the way, as it were, for a bit more open discussion. And actually, if I get bad feedback, I'll learn from it. And it was an enjoyable time. Actually, it was actually a fun chat. It didn't feel like I was recording a podcast, and so it was nice.
Yeah, I mean, I guess I was addicted to fun, which is quite addictive. And now I'm okay with not having so much fun.
We should always have fun, Haidar.
I don't know. I mean, it's like fine now. If it's not fun, it's fine.
What's happened to you? This is such a difference. Contrast. My goodness.
I don't know. It doesn't have to be so fun. I mean, I remember in clinics, you kind of do stuff in order to make it fun for yourself and for the patients.
Yeah.
But now it's functional.
Oh, Haidar.
Functional clinics.
I can't ever imagine those words coming out of your mouth. I just cannot.
Oh dear.
So, okay, so it's now.
So there's a change there, which is good. That means there's potential for anyone to change into the opposite.
And you think this is a good change?
Yeah, I do. I think, if you can realize within yourself that you can change into the opposite, and then that can be another part of your repertoire of abilities, then you can actually think to yourself, well, do you know what? There's a lot more to me than what I see, and there's a lot more potential for me to change into something that's, better, so to speak.
Sure.
And there's always something better out there, a better device and a better instrument, and we know what better means, so to speak. So yeah, it shows that thing that you wouldn't have ever dreamed of becoming, you can actually become that thing.
Okay.
So yeah, that's what I mean by it doesn't have to be, everything has to be fun. And
but here's the crux of the question then. Did you find yourself forced into changing, or was it just a natural change? Like, for example, did you find yourself having to change because, do you know what, I'm getting into too much difficulty?
Absolutely. Yeah. I mean, once you realize that, you're forced to change, then you have to change.
What's that done for your inner psyche, as it were?
Oh, it's still there. So my fun Haidar is still there, but then I've got another, feather in the cap.
Okay, so you haven't found it suppressing in a way?
No. Suppressing means something unconscious. So it's more conscious now.
Okay.
And that's what it's about. It's realizing that I was unconscious during those times of, excessive fun. And now it becomes more of a conscious process. So that comes within the conscious, within your conscious realms of the psyche. But as you know, most things are unconscious, and there's a lot more unconscious within us than there is conscious. So there's always so many other things to work on and reveal within yourself.
And just playing devil's advocate, so to speak, by consciously holding yourself back from potentially being the person you were letting out before. Yeah. Has that made you unhappier?
No, I don't think so. Happy is a kind of, I'm not really a fan of the happy word.
What would you use?
So, I mean, I would say I have less negative emotion. So less neuroticism, which is one of the big 5 traits. People say that happiness is extroversion without neuroticism. So it's that bubbly, outgoing, assertive individual. So there's a lot of extroversion there, but without the negative emotion. So, when I was the bubbly, fun Haidar, there was negative emotion there as well, but it was masked by the extroversion.
So was that negative emotion from criticism that resulted from your personality, or is that negative? Was that negativity there, and you were masking it with your personality?
Masking it with the personality, but there are unresolved issues there, which I didn't go into and didn't deal with and didn't resolve.
So in a weird way, not being that same bubbly, outgoing to the same extent as you were, say, the first time we met, is you being happier and more at peace with yourself, so you don't feel you need
more
to...
contented. Yeah. I mean, I quite like the word contentment rather than happiness. But yeah, I mean, happiness is a nice word as well. But the days are gone of regular Coke and sniffing all that white stuff. It's there, it's a potential, it's a possibility, it's a past, but yeah.
Oh dear. it's there we go.
Yeah, it's there, you see. It's still there. It's just to sort of show you that it's available. But I think once because I've taken on a few more leadership roles, and I've realized that can be quite too much for some people. This too much extroversion.
Yeah, has taken on the leadership roles more and more, so sort of giving you a bit more of an insight into some of the problems that
I have.
Oh, I see.
Yes,
okay.
Yes, because you look at the problems of other people and you realize that you have those same problems, and then you see the effects of the problems of other people act out, and then you realize that I've made so many of these mistakes. So you think to yourself, right, there's a bit of work for me to do here. So that's what happens, because you do have to interact with so many more people in leadership roles. So you do have to be much more attentive about yourself and about your behaviors and about how you think and how you act. So it's a great self-regulating process. If you want to be a good leader, that is. I mean, if you don't want to be a good leader, it's just turn into a tyrant and destroy everyone around you, and then you lose that structure, and then there's nothing left for anyone, and
you're left wondering why.
Well, I mean, if you don't ask the right questions, you'll keep making the same mistakes, and it does. I mean, if you don't understand it, you won't remember it, and that's what it's about. So you've got to keep asking those questions about what is it here that's not working, what is it here that's working, and what's the difference, and where do I come into this? So there's a lot of internal introspection.
It does make sense, actually, what you're saying. With as you've got more and more responsibility, then things mellow out, because you realize more and more is depending on you. And we see that. I remember just starting out as a junior doctor, first year at med school, bit of a joker, and you play around a bit more, as it were, with your friends, and you make more jokes at work, and as time goes on, you still make those. It's still the same person, but you restrict yourself. You realize, actually, I'm more senior now. I've got more of a onus to be responsible. So it does mellow you out.
Or also the kids are getting older. I mean, my son's nearly 20, so when I see him act and do the things that he does, instantly in my head I think, right, this is me. Right, I understand where this is coming from. And then the light bulb goes off inside your head and you think, right, I need to change this. And it's the same with, my daughters and, people close to you, because you interact with them so intimately. You can see yourself in other people. And that's when you can, realize that, I've done so much projection, so to speak, on others, and I can see myself back from their behaviors. So yeah, that was probably another big catalyst.
learning from
other people close to you, and what's the word? Yeah, I mean, mistakes that they make, and you realize that it's your mistakes. So, yeah.
Wow.
Yeah.
We were chatting actually earlier with your son.
All right.
Just before you popped in, and we were. Yeah, it was a few years since I've spoken to him as well, and definitely changed, and for the better, of course, but just a different person. I couldn't recognize him immediately. It's like, oh my goodness, it's and so people.
Yeah, I mean, having someone really close to you, it's you've got to keep working at it, and you've got to maintain the work and the relationship, and it's hard work, but it's meaningful hard work. It has has a purpose behind it, and if we can translate that into our profession, it just becomes that bit more worthwhile and that bit more easier to deal with the difficult times.
Yeah. That's very insightful. It's been lovely as always.
Well, thank you for sort of coming along. I mean, I do apologize for not being too fun and, old, crazingly.
Hey, you never have to apologize. It's always always a pleasure, regardless.
But the laugh is still there. The laugh is still there.
No, it's nice to see you calm.
Calm, yes.
It is nice. Yes. It's enlightening in a way. It's food for thought. It's someone that I never thought would change, as it were, in that way.
Yeah, so there's always hope. You see, and there's good hope, isn't it? That we can always change into something we wouldn't have ever dreamed of changing into. So that potential is there for all of us.
Thank you, Haidar.
Thank you, Paul.
Thank you for listening to A Doctor's View. If you're enjoying the show, please don't forget to subscribe or follow on Apple Podcasts, Spotify, Google Podcasts, or your favorite podcasting platform so you don't miss a future episode. If there are any topics you would like considered for the show, please get in touch via email at adoctorsview@gmail.com or visit adoctorsview.uk. And be sure to follow the show on Instagram @ADoctorsView for some behind-the-scenes posts. See you at the next episode.